Just to kind of give a little bit of insight into who I am. Let's see, there we go. Just here's some facts about me in case you wanted to know. Graduate from BYU, been in this field for about 12 years. Have a lot of experience working in community development as well, in addition to a clinical practice. The supervisor here, I'm from a rural area, so I often feel like I struggle with being in any big city. Even though Payson really isn't big, it feels pretty big to me. But it also means that I'm pretty used to the big community needs that you see in rural settings. Yep, you guys are welcome to read that. Here are our objectives for today. You take a moment to look at those. And then let's start out with some theory. So I'm going to be using a lot of combination of some philosophy and a lot of works from lots of different authors today to kind of talk about this idea of trauma in our practice, how we see trauma show up, kind of give it a new lens and a new way to think about it, and how vulnerability might play into that. But the first idea I kind of want to put out there is that of Gandhi. As you can read right here, Sarvodaya is this idea that healing is communal, that between a consumer, or like a student and a teacher, or a consumer and a provider, or a client and a clinician, whoever it is, that there's this ecosystem of mutuality that must be beneficial for all, for it to be beneficial for even the one. It's a little bit of a flip of sometimes how we think about our practice. I kind of want to drive into that a little bit in our time today. Martin Luther King Jr. also talked about this idea, about how we must all learn to live together as brothers, or we will all perish together as fools. We are tied together in the single garment of destiny, caught in an inescapable network of mutuality. And whatever affects one directly affects all indirectly. For some strange reason, I can never be what I ought to be until you are what you ought to be. I think that phrase, especially about in an inescapable network of mutuality, can't get out of it. This is kind of the way things go. So that's kind of part of the paradigm I want to come from today. And to launch into introducing what I'm going to call kind of this collusion of trauma, I want to start with a story to kind of give a framework around this. It's a parable that's, all my stories are a collection of lots of people's stories of who I've worked with. So if any pieces sound familiar to maybe things you've done, they are pretty normal stories. But it isn't about anybody specifically. So we'll say in this story, it's about a woman who has dyslexia. She walks into the doctor's office with her infant. She appears nervous. The secretary asks, like any secretary would, for the name and the date of birth of this child. After giving the name, the mother tries her best to give the birth date, but continues to mix it up in multiple attempts. She confesses that she has dyslexia and struggles to remember the order of numbers. She does say, but wait, I remember that the child was born when the lilacs were blooming and there was a full moon, like trying to almost prove that really, this is legitimate, this is really my child, and this is the one that needs to be here for the appointment today. But the secretary feels a little impatient about this and states that you can't check someone in if they can't be verified. The mother starts to cry because she spent all month coordinating childcare of her other 5 children, or her other 4 children, forgive me, just so she can be here to see the specialist, and now she's feeling like it might not happen. And the secretary asks in that moment, somewhat doubtful, are you the mother of the child? Almost questioning the validity of this mother. And the mother starts to become a little argumentative around this point. So we're going to kind of break this down a little bit more, and then we're going to kind of put it into this collusion of trauma to make sense of that. So keep sticking with me here. So this is kind of an outline of breaking down the behaviors. I always start in the middle in this because there's two people playing in this scenario. So here in the middle, we got a dysregulated mom who just can't remember the order of the numbers of her child's birth date. And she becomes increasingly panicked, fearing that she might not be able to get care again. She's been there before, feeling frustrated and embarrassed. And next step may become argumentative and defensive. On the flip side, on the top side of this, we see a secretary who's really worried about, legal protection, making sure we identify the right people, that we don't give services to the wrong people, and even wondering if we have a legitimate, pair up here. And decides to maybe set some boundaries around that and even start to question what's going on. So we're just kind of breaking that down, and now we're going to put that into this collusion. Now, this collusion of trauma is pulled from lots of different theories. The idea of the interconnectedness of trauma between systems and providers is not a new idea. It's one that Chandra Ghosh-Ipin has put out there in her butterfly effect training and in the book that she's co-authored about Don't Hit My Mother and other CPP texts. But that concept, in trying to kind of simplify it for our time today, I've kind of superimposed it into the Arbinger Institute's model of collusion of conflict, just to kind of make it a little more digestible for us today. So it's not new, but the way we're talking about it is a little different, just to make it work for us in our time today. In this collusion of trauma, what we're trying to say is that the perception of a lack of safety in one individual kind of leads them or elicits a response in them that might elicit a feeling of a lack of safety in the other, and then they respond out of that, and then that feeds into or verifies or validates their very sense of a lack of safety. So for example, in this case, the mother walks in, she presents as not being able to remember this birth date. She starts to become argumentative. Then that makes the secretary feel like this may be a little suspicious. So then they respond with some pretty stiff boundaries. And then the mother starts to feel more panicked because she feels less safe, that she might have been denied care again. And then that's going to increase the problem and the sharing of behavior, and increase or escalate the situation rather than find out that we're actually meeting needs. So that's kind of the overall concept. Now, that's just the introduction to this part. Any questions on that before we jump into some more things that I'd like to layer onto this concept of collusion of trauma? In the few of you I see, I have just some shaking of heads. Oh, yep, I only have a few people who are up. Okay. Well, I'm going to expect for you guys to just interrupt if you do have anything. Okay, so I'm going to be giving you guys another couple of examples. I want you to apply it now. I want you to start thinking of, okay, when I give this example, how can I put this or superimpose this story, this situation, into this collusion of trauma, and how might that inform me or help me to understand how both parties are almost kind of making the situation worse? And how does that help, how does that kind of, excuse me, I need some water, inhibit each person from becoming who they ought to be, reflecting back to Dr. King's quote there. Okay. So if you understand that, now we're going to add on to it. So I'm making the assumption that all of you guys are some sort of practitioner. You're either a teacher and you have lots of students, you're a provider of some sort of service, you might be a clinician and you have clients. So I want you to think about yourself and your role in some sort of way of helping, being part of a system and being in a helping environment. So we'll start with KC. Casey is a 35-year-old woman who has been court-ordered to do domestic violence evaluation. She was reactive and pushed her partner away when her partner attempted to stop her from hanging herself. She has been doing the role of mother to 5 children in a blended family, working and doing most of the chores at home. So she's pretty overwhelmed. And now I'm getting dry throat from all this talking. Okay. Okay. There was no children present at this moment of domestic violence or pushing or whatever you'd like to call it. But at her evaluation, she was recommended to do 12 weeks of DV classes. When she told the judge her story about what went on and asking that she get more mental health treatment to address the underlying suicidality and to focus more on that rather than having a criminal record that can inhibit her from having future jobs, he basically threw the book at her, as you'd say, and said, "This is what you get for what you did." And as a result, there was some parenting time that was kind of at stake for these additional charges, and she lost some of that additional parent time. She did leave that partner, and she did move in with her parents. She finds that she still is pretty reactive and argumentative with people, but only in context of her family, her mother and sister in particular, who also have some similar personalities of being dismissive. She has a long history of unmet sensory needs that have often been dismissed by her community and family. She's been threatened by her family that she'd be kicked out if she argued with anyone in the home. She has only had an increased desire of suicidality and taking her own life because she's felt less and less support by her family that she's been trying to argue for and advocate for, and because she's been feeling criminalized by the justice system. In the end, she just really wanted someone to be able to sit with her and work her through all the things that's behind her suicidality. So again, remember, your goal is to take the story and do your best to think about how to put that in occlusion. Your first thought is, okay, who are the actors here? And I've tried to put the two boxes or the two actors, kind of pared it down to the judge mostly and Casey. So hopefully that gets you a starting place. So you're going to think about these two boxes, superimpose those two on them. Oh, sorry. I just talked so much I forgot to give you the pictures that went along with it. We'll have to move on. Here. So, again, this is the same thing. We're just kind of breaking down the behaviors, looking at it. The starting part is Casey has a significant life stressors. She attempts suicide. She has a lack of support. She seeks that from saying, hey, could we do this instead of that? Could we get this mental health support instead of, a criminal record? She feels dismissed in the system. She shuts down. She becomes more emotionally reactive and suicidal. She becomes angry with the judicial system. She avoids trying to do treatment because she's pretty upset. And things like that. The judge, here's the top part, I hope you're reading it, has previous experience with people who have tried to manipulate their way out of their consequences. Maybe he feels rushed, decides to set some boundaries, and he feels pretty validated when they don't show up doing what they're supposed to do because, that's what Casey did. She didn't want to show up at first and follow through with recommendations. So, question for you guys. How would you put that in there? Do you think you got this? Anybody want to give it a stab? The answer is no, that's okay. But I want to see if anybody would be willing to.
I'll give it a shot.
Love that. Thank you.
So if I understand you right, like on the left, you mentioned the judge first. So you would say the judge sees lack of safety with her behavior
Mm-hmm.
because of his past experiences and his maybe mistrust for what others have done.
Hmm.
And Casey, in turn, in the next box, sees the lack of safety from the judge's behavior and lack of support. Um, and yeah, everything actually just exacerbated her problems by feeling so isolated, um, and not actually help through the situation.
Lori, I really appreciate your participation, and that's spot on. That's really good. So here we see this the judge is saying, I'm really wanting to protect my community. I really don't want people to be out there who are going to be hurting other people. And if you're going to be somebody with maybe criminogenic thinking and you're going to go out there and offend again, I really need to put some stiff boundaries around that. I'm really worried that you're one of those. And so I do see this lack of safety. I do worry about what's going to be going on in your mind. I've got to have some pretty stiff boundaries. And, Casey's feeling pretty dismissed, pretty unheard, pretty misunderstood, and wants to withdraw. Perfect. I think you landed that so well. So well. Thank you. Good. Good.
It may have
So,
helped that I was in court with someone this week on something similar. So
oh no.
just
I hope I'm not bringing up any trauma wounds right now.
no, no, no. I was glad to lend support and help somebody.
Oh,
Uh,
good.
yeah,
Good.
yeah. Thank
So, part of the multiple perspectives I'm bringing in here is, we kind of have this consolidation, bringing together, the work of the butterfly effect and Chandra Ghosh Ipin, and using that model of Arbinger Institute to kind of bring it together for our choice today, our presentation today. But part of what we're trying to explain is not only how these two feed off of each other, but how there's a lot of back history behind it. They're not the only actors in this story. So if we were to peel back time and kind of look at it at a macro perspective, we would see that there's kind of this underlying theory that has guided a lot of the judicial system for a long time in the past. Now, there's a lot of changes that have been going on in the last 30-ish years, 30, 40-ish years. But if you look at like the long term, um, there's kind of this underlying theory or a thought about the judicial system, and that thought is called the rational choice theory. Basically, the idea is, people choose to commit crimes just because the rewards and consequences, the balance of rewards and consequences. So there's a lot more for doing something that's wrong for them, a lot more in it than there is against it. And so you increase the sense of punishments so that there's a lot less need to invest, or a lot more cons, a lot more consequences than there are rewards, and then they'll simply make a different decision. And that's the main idea. Now, when you simplify something to maybe that much of a theory, it maybe kind of feels like a little ridiculous. Maybe, I don't know, but that is overall kind of the guiding idea. Later on, especially after Freud and Bandura, we kind of have a combination of the biological and social theories, the biosocial theory, and that's a little bit more of that nature versus nurture. You probably learned that early on in school. That's where a lot of that comes from. That is a combination of things, and then we need to fix what we learn, the nurture. We got to get the right education in there, or maybe we need to fix the biology, get the right medications in there to help someone have better behavior. Now, there are other theories out there, but I want to focus on these two to kind of zoom in and say, this is some of the backstory of what might be influencing the judge's decision in this case. So let's think about that more pragmatically for a moment. I don't know if you guys have ever heard of the war on drugs. Sorry, I'm jumping a little too fast. I need to slow down here for a moment. So let me give some pragmatics behind that. So if you look back at way back, probably like just a little bit before World War II, World War I era. Well, forgive me. Actually, yeah, before World War I, some of the treatments we did in mental health were specifically out of this rational choice theory. Here we're coming in, we're talking about suicide, we're talking about KC, and okay, so we're thinking what might be guiding some of that. Well, a long time ago, rational choice theory guided treatment for mental health. I don't know if you guys have ever heard of those centrifuges they used to put people on and they'd spin them around, sending blood to their extremities, or the origins of electric convulsive therapy. It used to be used not as a way to treat, but as a way to be punitive. There was no medications to take away the nasty, painful, the side effects or actual effects of ECT, and they would do it again and again and again until the usually psychotic client would just pretend they didn't have psychosis, until they would just stop the symptoms. So it's a very punitive measure to almost increase the consequences of the behavior enough that they would stop it. And you see that, and you see a little bit of that going into even some of our other theories later on. So there's some of that in our history, even in mental health, and even you're probably familiar with, we use medications to treat any medical part or the bio part. Chlorazil, actually I won't go into that. That's probably not too important because of our limited time. But also we use classes. We say that somehow classes are how we change things. And that's true. Education is very important. Hence why we have so many people here who are in educational systems. But is it always the thing of change? Well, when we have the theories of Bandura and others, we say, well, nurture, if we just give them the right education, they'll change. But in this case, KC is saying, I might need something more than just education. I might need something more there. So anyways, so we have lots of these theories, and the judge is thinking, yes, you need classes. Yes, you need this. And yes, you need harder punishments. And this is a lot of what kind of goes on even in the clinical field. In a lot of things, we have these kind of archetypical artifacts in our system that still kind of influence how we think today. So that might be some of the history behind, just the kind of specifics, a few snapshots of specifics behind the judge's way of thinking. Let's give you some historical context to how KC thinks. So right here is a burning building. This is actually after Martin Luther King Jr. died. Here was a man who said, let's have peace, and let's, maybe peacefully try to make change. And after he was murdered, guess what some people did? They said, screw the system. It's not going to work. And there was a lot of riots. And that's what happened here. Anybody know this one? This is 1992. This is the LA riots after Rodney King was murdered by 4 white police officers. Ideally we would say, okay, let's just trust the legal system. Let's say, okay, this happened. Let's, take these men to court. But this was actually a whole community of people who said, we don't trust the legal system. We're going to refuse it. We're going to reject it and use lawlessness to try to get our conversation heard. Which, if you're starting to think about the collusion of conflict, by the way, only exacerbates the conflict. Did I say collusion of conflict? Sorry. If you're thinking about the collusion of trauma, only exacerbates the trauma. People are going to feel more afraid, right? They're going to feel less safe in their community. Now, in the recent history, you guys probably know this one. You've heard of the defund the police campaigns. You've heard of the Black Lives Matter campaigns. 2014 was what started the defund the police campaigns with the murder of Michael Brown. In 2020 was the Black Lives Matter movement, and that started with a few murders of police incidences with people who were black. So again, these are all kind of these things where people are saying, I don't feel like this system is working for me, so I'm going to try to distance myself from it or refuse it or fight against it in some way. So there's a lot of people beyond Casey and the judge who have a lot of this historical stuff showing us they're not alone in what they're doing. Sorry, this is what we just talked about, but it was written out. So I want us to superimpose that into this collusion of trauma. We have a whole legal system who sees the problems with lawlessness. And there is problems with lawlessness. And so they see that the answer is, well, we need to be really strict. And there is some truth to that. But I also want us to be mindful that when we also have a system that does not hear and understand and see what the underlying needs of those behaviors are, and people are feeling dismissed and misunderstood, that we're actually exacerbating and eliciting some of this, well, I don't feel safe, I'm going to react. Now, that is no justification, but it's a way to at least framework things so we can say, okay, if we think about it this way, there might be another way to meet some needs here. And that's, of course, where we'll eventually get. Okay. So, in part of my presentation, we talked about vulnerability. Well, it mentions vulnerability. And I want to define vulnerability a little bit different than maybe before. And here it is. I'll just read it to you. It's the capacity to have compassion for all parties. And why is that vulnerability? Because you have to be able to sit in your gut, really let it sit in you, the perspective of all parties at their truest, most, core form, in a way that you're no longer afraid or angry with someone. You only see the humanity in them. That's a difficult place to be, because usually if we're not there, people are scary, systems are scary, they overwhelm us, they frighten us. But when they become human to us, that fear should dissipate. So that's why I say vulnerability there. And in this case, I'm going to propose and try to show that the role of vulnerability would stop the collusion of trauma. And in order to do that, we have to ask two questions. They're there. There's the two questions. What is alive in us? And what can make things more wonderful for us? Of course, I broke those two questions down into two more questions because the us always has you and me. But what is alive in us? This work comes from Marshall Rosenberg's work on nonviolent communication. And he has a couple of books out there, and there's a lot of trainings out there about his work. So if I'm going too fast, or if this feels like I'm not giving it enough attention, I'm really not. And that's a very fair complaint. And I'd be happy to share more if needed. But I want us to think about this for a moment, and we'll kind of dive into that a little bit more. Okay. I want to take a little bit more time explaining this part. Just gotta get my notes to catch up with me here.
There was one question in the chat. Someone was wondering who you said the reference
Oh, Aaron, kind of, what did you say that reference is? Okay. Here's one of his books, Speak Peace in a World of Conflict, Marshall Rosenberg. Is his name there? Oh, sorry, my fingers are covering his name. Marshall Rosenberg. Yeah. He's also the author of Nonviolent Communication. Same concepts kind of in both books. Yeah, but this is how he'd start any conversation. And he's a man who has spent a lot of his career trying to create peace in conflicts anywhere from within the family to global conflicts and war between tribal nations. And he'd always start with this question: what is alive in you? What is alive in me? And that's the question of vulnerability. Because often, for example, in spats you might see, maybe in the example of KC, you might think, okay, they would say to each other, well, I want you to stop being a, judge high on your mighty saddle and, doing whatever. Well, that actually doesn't communicate what's alive in you when you accuse someone. What we'd want KC to really get down to is identifying things more like, what's really alive in me is a desire to be a mother to my 5 children. What's really alive in me is my fear that I'm not doing it well enough and that I've been trying to hold it all. and that it hasn't been enough. What my fear is that very core thing I want is being stripped away from me, and I'm so desperately scared that it's going to be, and that I would never do anything to harm any of them. Like we're trying to boil down to what's driving all those behaviors, and for Casey, that would be what would be alive in her. But ironically, what's alive in the judge? Well, we could say, what's alive in him is he sees there's this, criminal in front of him who's no good and needs to be given a couple, slaps around to shape up. Well, that's actually not really talking about what's really inside of him. That's actually a dehumanization of the judge. There might actually be something more there. Maybe he's actually truly scared to put somebody back on the streets who isn't ready to be safe. That he feels some responsibility to help create a better world, and that's why he went into this. And he maybe doesn't always know how to do that. He wants justice, yeah. And justice is a needed way to help people heal. We can't heal without justice. Now, what justice looks like might be a good debate, but that is true. Because accountability is part of that, right? You did do this deed. Thanks, Jolie, for participating. I love it. Anybody who wants to participate, that would be great. And I don't know if I pronounced your name right, so forgive me. So anyways, that's kind of the idea of what's alive in us and what would make things more wonderful for us. A lot of people really struggle to identify what that is. Sometimes we'll say things like, well, if you would not do this, or if you would fix these things, that would make life more wonderful for you. But really, what makes life more wonderful for us is identifying those things that are wrapped around what's alive in us. I'd like to find a way to be able to be that mother to my children and find that space to give that compassionate caring to them that I've always felt, I could do. Or find a way to give the judge the resources to really identify and triage people in an effective manner so he could effectively feel like he is making the best decisions he can, right? And so he feels like he's doing his job adequately and making that world a better place. They're usually that wonderfulness is based in that part that's really alive in you, that core piece. Okay, so now I'm going to shift gears here again. We're jumping. I'm throwing lots of ideas out there. I'm going to have to mend them together here in a little bit. So put that aside. Jump with me to another part. Ways I see practitioners, teachers, providers, anybody who's kind of in a system that's trying to work with students, consumers, clients. Things I hear happening are kind of these. And these are things that create distance. These are ways that we tend to participate in collusions of trauma. Now, I just wrote them out here. These are things I hear, but effectively what they do is they create distance from us and our students, or us and our consumers, or us and our clients. And it doesn't allow us to have the vulnerability to truly just sit with them. And I'm not going to read the whole list, but I'm going to go over a couple of ideas. So if we're looking at, maybe somebody says, this person's not ready to change. Okay, that again is not identifying what is alive in you when you say that. That is creating distance, and it's kind of a little too superficial. So when you hear that, or you feel that, they're just not ready yet, I might scale that back and I might say something like, okay, what is really alive in you in this moment? What's kind of driving that distancing from this person and just kind of pushing it all back on them? And often what I see is people are just overwhelmed. They don't know what to do to be helpful. They feel like they've tried everything and they haven't, and nothing seems to have yet worked. Or maybe there's a feeling of I have some responsibility to get this done efficiently. There's a court date coming up, or insurance companies dictate that I can only have so much time. or the semester is only so long, and so there's some pressure to get it done, and so we feel like we have to we have some urgency behind it, and so we again are feeling unaware of how to just move things forward. So that's so much more alive. Instead of saying you aren't willing to change, it's this, I'm not sure what to do. Or maybe another one is when we say somebody's codependent because they're really bad with boundaries, right? They just seem to be violating all these boundaries, putting themselves at a lot of risk, and they keep doing it. But then again, something that, as simple as saying that, we have to then go say, okay, what's really alive in us? What's really going on here? Well, we really care. We really, really want the welfare of this client, and we're really confused that they can't yet see it. So just hold those pieces in mind. Like, if these are just examples of us getting to that deeper place of thinking a little more. So I want you guys to go through this list in your own mind and think what might be behind any of these labels that any provider, consumer, clinician might have. Keep thinking about that. I'm going to share a couple more, and then I'm going to open it up to you guys. The need to maybe teach someone a lesson, or saying all they have to do is try. You know, there's, when you say that all someone has to do is try, there's this feeling of that there's a lack of motivation, and that this is their flaw. And that comes from just the simple fact that we're powerless. We can't really move things on without them. And that powerlessness is a scary place to be, especially when so much is at stake. So that's kind of that part. Let me move on to one more here. Sometimes, as in our role, there's also this tendency to dismiss or maybe even control, because we just can't fix things. Because things feel violent or threatening, or they're so big that they are overwhelming, like poverty and politics and racism. Like, they're just so untouchable that friends and providers just try to distance themselves again by these methods. So just kind of let me open up for you guys. I want a couple of you to take any, statement that you've heard in your work, maybe even in yourself, that has kind of felt a little off-putting. I want you to try to name it and maybe think of what was behind it. What is that part that was alive in you that was really motivating that? And I hope this works, because again, like I said, this is like Marshall Rosenberg's work in like 10 minutes so far, so hopefully it makes sense. I can't hear you very well, Erin.
You can't hear me?
Can you move your microphone a little closer?
Sorry, I'll lean in.
That's
Someone's
perfect.
asking if you can repeat the question or the activity.
Absolutely. Oh, I didn't see that. Thank you. I just wanted you to think and reflect on this concept. What are judgments that you feel you've heard? They could be on this list, they might not be. That feels like it keeps some of that distance, kind of like that lack of really being human with whoever you're working with, and you just can't sit with them. Think of that statement and think of that, how that gets in the way, or forgive me, think of what might be underneath that. What is that piece that's alive in you? Maybe just one more example is they don't want to be here. So a lot of my work is in, actually I do a lot of different work. I work with children doing child psychotherapy, I work with families, I work with couples, and I do substance use treatment as well. A lot of court-ordered people, a lot of not court-ordered people. It's kind of a blend out here in Payson. It doesn't feel rural to me, but it's kind of treated rural. But anyways, so they don't want to be here. They clearly aren't motivated. Well, again, ooh, somebody's writing. Okay, let's. When I feel betrayed, that creates distance. Okay. Yes, when you feel betrayed, that creates distance. Okay, good. Betrayed by their story. Ooh, I like this. Yes. Yeah, so you're noticing that I have been vulnerable enough to open up to you. I've been trusting you, giving you my best, and I am scared if that's going to, if I can continue to show up that way, and if it's going to continue to be misused. I need to know and have some sense of trust in this relationship. Great. While an intern at a community mental health clinic, I often heard talk of clients coming through a revolving door. Ooh, that's a good phrase. We got to talk about that one, but I've got to finish reading it first. They come and go quickly. I wonder if this is what you're describing. Absolutely. I think it speaks to a sense of powerlessness to people who face so many barriers that even attending is difficult. Yeah, the revolving door, like we just, and that kind of speaks to the sense of, yeah, no, exactly, that powerlessness. Like, we don't feel powerful. We don't know how to help this or stop this. It's beyond our control. We see the pain that's being caused by this. We might even have some, why can't I think of the word right now? Imposter syndrome. When you see that what you're doing isn't working for everyone, we can sometimes feel that imposter syndrome come in. So we're going to have some self-doubt. When there's a revolving door and people are like, this isn't working for us. And that's kind of part of the pieces. And why do we have imposter syndrome? Because we care. Because honestly, we want to know if we're actually making a difference, right? We want to make sure this works. Yeah. When someone in authority does something for personal benefit but not mutual benefit. Oh my gosh, I'm not going to be able to keep up. Okay, let's try this. By the way, keep them coming. It's fine. When someone in authority does something for personal benefit but not mutual, I think what you're speaking to, tell me if I'm wrong, Jolie, but what I'm hearing you say here is you want to, you feel that the system is not, the system being like the people in power and who have been put in a position for a reason, hopefully, and that reason isn't being met, and I don't feel like and there's this lack of trust with them, and that they've turned it to personal gain, and that does create a disconnect. That's kind of more of the KC side, right? That's that I almost feel this desire to. I've been kind of speaking almost to the like provider side, but that's almost to the KC side where there's this lack of. I'm almost wanting to push against the system or talk about it or somehow challenge it because it doesn't feel like you're really in it for the right reason. I don't know if that's kind of what you're speaking to. Write more or speak up if I'm off. Jennifer, when I feel profoundly impacted by their experiences, it can create a great deal of sadness. And we are taught to compartmentalize that so it has to be dismissed in some way, and that can get into this. You are spot on. I remember in graduate school, had an awesome teacher, very, very punctilious and to the point and like just so detailed oriented. It was really good in a school setting. And one of the things she taught was, do not be vulnerable. Do not share anything. Do not open about anything in your life. It's not about you. You are a closed book 100%. There's nothing you share whatsoever. Okay, I mean, it's true. We can't make our services about us. That would be unethical. But there's also this line of like, okay, are you also a human? So I think what you're saying there is when you allow yourself to actually connect and to feel with them, it can be hard. And just as a practitioner, I try to practice authenticity enough that when people share a sad story and I feel like weeping, I weep. I weep openly because they need to know how absolutely distressing their story is and that it does affect me. But I also have to admit, weeping's really healing as well. I know it might be scary, but if you think of that MLK, Martin Luther King thing, that mutuality, that healing is for both of us. I have found greater power and resilience when I allow myself that space. Okay, let's see. Or it might be a boss of a program that could benefit the vulnerable. It's true, there's like lots of social enterprises that are meant to benefit the vulnerable and those that are serving, and they totally take a lot more for their own benefit. And that's a question we're going to have to think about. Like, what is alive in them that justifies that kind of behavior? And we don't want to somehow put that onto that collusion. But they are coming up with some sort of story in their mind that justifies that behavior and makes it feel like the distance they're putting out there between them is justified. We'll have to think about that. I might have to, if we have time, we might have to think about how that would fit in this theory at the end. It's really good. Okay, anything else before I move on? I think I got through all of them. Did I, Erin?
I have something to add. I don't know if this is
Melissa.
yes, Melissa. I'm not sure if this is what you're talking about, but I work in hospice. And so I deal with a lot of folks that have very significant health challenges. And so it seems to me what you're teaching is, would create like there's a lot of vulnerability, there's a lot of trauma. And then there's folks that are well-meaning, like nurses and doctors who may not have the skills, right? Which most of them do in hospice, trust me. But just to, think about this intersection is just very interesting to me, in this collusion of what they're dealing with, because it's very traumatic when people, are on that path as opposed to getting cured.
No, I think you're right. I don't know what the stories look like because I haven't done hospice specifically, but I could imagine that, you're a provider who came to the field with the intention and that core part of you to heal and make better and save lives.
Right.
And you, in the end, are basically helping people to die in a way that is the least painful, most peaceful way possible.
Comfort is everything. Yeah.
Right, and yet you have this question in your mind of why the heck did you do this to yourself?
Yep.
And so you might hear some providers come out with those judgments, but what's behind that judgment is that powerlessness.
And fear. I think fear is in it as well, and frustration. I think about our young patients who maybe smoke, their whole life, and then they end up with emphysema or COPD or, or whatever. I mean, there's lots of people who smoke who have no problems, or lots of people who drink, or alcohol is a big one. That's a big one because there are so much judgment around that. And I think we do a really good job not to be judgmental about that, because there's plenty of people that end up with cirrhosis who don't have a drink of alcohol their whole life. So it's just kind of making sense of it all. And this is actually really helpful. This is really helpful to try to understand the trauma that I think both sides of the care perspective, the caregiver, the patient, the nurse, the doctor, the social worker, that we're all faced with in this work.
That's really good. And I appreciate that example because I'd want to, add on to that collusion of trauma by thinking about some of the maybe more systemic and historical factors behind it. For example, maybe behind the medical provider and their desire to be part of this helping profession. And yet, the helping profession also does have training about, I guess, how do I say this? There's a lot of emphasis on, we need to do our best, fix the problem, solve it. And there's also a lot of legal training, like, and if I don't, what happens? There's a lot of fear in medicine. I could be sued. There's things like that. And in the hospice, I doubt that's the case. But medicine generally, one false step, you could be sued. There could be a problem. Be up on your game. Do it right. People could get angry at you. there is kind of a lot of that stuff built into it. There's a lot of movement currently against medical practitioners that we'd rather go homeopathic, natural, things like that, because guess what? There is distrust of the system. And so now you have this person who wants to be a provider, wants to be a healer, and people are coming in a little jaded. And yet they also have a reason to be jaded. And so how do you help them to see that I'm coming from this place, and maybe I respond a little authoritatively, like this is what we need to do, and I'm going to be a little bit of a jerk about it. But that's because of that fear. How do we help balance that, and yet at the same time, a consumer's fear that they could get hurt again, or that they could be dismissed and not seen, or that they do have other people in their social circles who have been hurt and harmed and needed something different. Like, there is so much to think about here. And that is actually why I skipped the slide, but I wanted to talk about ports of entry. Ports of entry are this idea of noticing common everyday themes that keep coming up. Like, for example, maybe Casey, who would say, I just wanted to be a mother. I was just overwhelmed. Like, you just notice these themes coming up again and again. And speaking to it in a way that's not judgmental of one party or the other, but actually holds compassion for all. And this is a big idea of child-parent psychotherapy and that systemic way of healing trauma within a parent-child relationship. And it's intentional because when you think about Martin Luther King Jr.'s idea, and Gandhi's as well, if we go in and we say, well, this judge was, we go into a client and we say, this judge is a bonehead, you should have never been treated that way, it's actually probably not as healing as a statement and an understanding of compassion for both. And I know that's kind of hard because sometimes people are so angry. But having worked clients to this place of what's behind the anger, you actually see them move a lot more fluidly when they're no longer blaming, but turning to advocacy. So a way to balance that compassion may be this statement here, so many people are scared. Our whole nation is scared of crime. Why? Because we don't understand why it's happening. We have this whole war on crime, and yet we're not solving it and decreasing it drastically, right? It's still happening a lot, and you might know that fear. And in that fear, they have pushed you away. They have sent you away and said, you know what? It's not working for us. Just go back, do your time, figure it out. And so now you feel alone, and you feel misunderstood by somebody who represents society. You now feel judged by society, and you wish they could just see you as the mother you really are. Do you see how that holds all sides? So that's kind of this idea of when we can approach systems and people from this perspective of saying, okay, I see the interaction here, and I have to hold it all, and hold it all enough that maybe even if I'm part of the system, that we can hold this together, that they can then say, okay, this can lead to vulnerability that heals. So the next what's on my agenda, as I know I only have 30 minutes, is to use another new example to kind of bring a lot of these things together. But before I do, any other questions, thoughts? I think that's true. They are trying to make sense of it all. I know how you say it. Okay. Part of, I just didn't say this before, but a lot of times powerlessness, confusion, insecurity. When I say insecurity, that's kind of the imposter syndrome. Fear, ignorance, we just don't know. And this is a big one. Fear of violating deeply held values. As a provider of a service, oftentimes part of the reason we may have that part of us, that lack of vulnerability, that kind of creating distance with people out there, is because sometimes they challenge, or it feels like they're challenging, deeply held values. Powerlessness, we don't know what to do. Confusion, because, you know, they say one thing but they're doing something else. Insecurity, we're not sure if we know what to do. Fear of being hurt by the other person. Ignorance, because we don't have all the information. I guess that's just lack of knowledge. Ignorance is too strong of a label, sorry. But I think one that I see a lot is it feels like we might have to compromise a value. And often, if we could just hold it as like, wow, I feel like my values are being compromised, if we could just dig a little deeper and see actually that there is something alive in us, it's deeper yet. That's the whole idea of Marshall Rosenhan's work and of what Martin Luther King Jr. said, is there actually is mutuality. If what really is going on is the judge wants safe streets, and what is really going on is Casey just wants to be a mother to her children, guess what? They have the same goals. Casey wants safe streets for her children. She doesn't want to be fighting with her partner. The judge wants a safe society for those children as well. They're actually very mutual goals, but we have to get down to it. And those are the importance of those questions and that vulnerability to identify it. And he would say, Marshall Rosenberg would say, that when you listen to what's going on inside of you, you're authentic enough to do so, it can lead you to knowing what your needs are. That's the part that's alive in you. And when you identify those needs, then you move them into an action plan. He calls it a specific request, but kind of some sort of specific action that mutually benefits each other, because actually often they're almost always mutual goals. Nobody really wakes up and says, you know, I really want to just fight somebody today and make their life hellish and horrible. So if there aren't any other questions, let's jump into another example. Okay, I'm going to remember to push the pictures as they come up this time. So, SD, we're going to call it SD. He grew up in a family feeling like a black sheep, kind of the outcast in that family. And he talks about how he would identify and ask for his wants and needs, but often felt that they were dismissed, that they were too big of an ask, or that he was too needy or too wanting, and that they weren't like his other siblings who had normal, needs and wants. And he noticed that his siblings kind of gave him that same treatment, that he was the different, and so they would treat him differently just like his parents would. And he's a man that's very empathic, deeply moral. There's right and there's wrong, and he wants to follow it, and he almost has a deep intuitive sense of how to do it. And when he had questions of why things didn't work that way, people didn't feel like they had answers for him. There is this one time when he felt he was in love, and so he had some sexual experiences with a young woman, and afterwards had insight that this was very wrong. And so he immediately fessed up, said, I need to take accountability for this, went to the authorities, went to his parents, tried to address it. And instead of feeling like they were supporting him in making sure that there was a change and that things got resolved, he felt like they just criminalized him and treated him suspiciously and with lots of guards around him for the rest of his life. That he never, that he was always this person that never could have trust again, even though he felt like he really worked hard to always be accountable for him, and still lives up to that need to just be so authentic with others. Probably even frighteningly authentic, because a lot of us, have some good skills of knowing it's probably not the best place to share those secret details. He's just very transparent. So he eventually decided to leave home because it wasn't a place working for him. He was old enough to do so, and he moved in with his grandparents, then he moved in with a friend, but he got so depressed after a while that the job he was working, he had to quit, wasn't able to pay rent, became homeless. Okay, so here we are, we have a little bit of trauma history, we have a little bit of homelessness. He's homeless for a year. He goes to the temporary housing, he goes to some people, some providers who offer temporary housing. He's able to get some. He's very transparent again about, you know, what he's doing, and he tells them that I'm going to apply for schooling, I'm going to try to get into school, I'm going to try to make my life better. Very intelligent man, could do very well. And they seem to have no problems with that. Time goes on, they find out he is in schooling, they kick him out. Why? Because they have a policy that says students can't be in this kind of temporary housing for homelessness. It felt very sudden. It felt very jarring to be so open and transparent and yet still have this happen like that. And so he eventually had to spend some time again with his family, and there was a time here where he felt very depressed. You know, was struggling with depression, but he had this moment of deep depression. He was in his room for days and days and days. And his parents were worried, and so they called law enforcement to say, I think we need to take him to the hospital. And law enforcement comes in, and he refuses to go because he's like, I'm depressed, I'm not going to go anywhere, I'm not going to do anything. And so then they take their taser out and tase him so that he'll comply and get in the car and go with him. And he ends up in the psych ward, of course, because that's what they were thinking he needed. And he starts to get these medications, but he's asking, why am I being asked to take these medications? What are they for? And he's told, you just need to take them. And he feels like he's not given enough explanation. And he said, these events broke me. I lost part of my mind at these moments, and I have never recovered it. And when asked more about that, he turned to me, and forgive me about the graphicness of this, but I think it's telling. He would turn to me, and again, I'm blending stories, but this particular part is one specific line. He turned to me and he said, well, if you were in a situation with somebody who had all the power, and it was rape your kids or rape you, what would you do? You know, those were the two instances. And I'm being like, well, of course, you know, I'm thinking in my mind, but I'm also letting myself feel it. But I finally understand in my emotional mind what he's saying. He's saying, they take a piece of me every time I'm asking for help. They tased me when I needed help. They kicked me out when I was absolutely open and authentic and vulnerable and was putting my life together and I needed help. They gave me all these medications that drugged me, but never explained what was going on, and I've lost myself since then. So that's kind of the analogy to rape that he was trying to use in that moment. And I think it's, you know, appropriate in a sense, and so I kind of get that. So, okay, that's him. So, oh, I didn't go through the pictures. Oh well. Sorry, I did it again. Okay, here's our collusion. Now, there are a lot of different pieces. I've put in lots of different collusions here. We have the system that works with homelessness and Casey. We have the family, I'm sorry, and SD. We have the family and SD. We have the police and SD. So I've kind of put a lot of different collusions here. Choose SD and one other and try to put it in. Just choose one that kind of resonates for you. Think about it for a moment. Anybody want to try and choose, you know, one system actor and SD and maybe piece this together for us? I'll just take the opportunity to do it because maybe with our limited time, participation in other parts will be important. But we'll just use housing. So here we have well, actually, yeah, let's use housing here. Because I think the police are a little more obvious. The police, they're probably feeling a little overwhelmed and unsure on how to handle a situation, and so then they go to this place of force. And that lack of safety is, this is a complicated situation. Somebody could get hurt. I don't know what to do. So we just got to get them to the right place. And of course, they use force to do it. So, anyways, but let's put that aside. Let's talk about maybe the one that's a little harder, and that might be the housing part. So, SD here is not feeling safe because it already has opportunities and experiences with systems saying that when I ask for help, they don't meet my needs. They won't see who I really am. They won't see how I'm trying to show up. And they will dismiss me or harm me in some way. So he kind of already has that lack of safety. Usually what he does in these situations is he shuts down. He just gives up, or he says, fine, do whatever you have to. Here's the application, here's the paper, take it. So there's no advocacy, there's no asking, there's no, please do this or don't do that. It's just roll over, take it. So if you can think about that in the terms of the word rape that I used, he would really feel that that's going to perpetuate his sense of hopelessness and powerlessness, right? Because he's not really advocating for any of it. So he sees the lack of safety, he's responding in a certain way. So when the housing system here comes in and says, you got to get out, what does he do? He gets out. He's not saying, wait, I'm confused. I told you I was a student. I forewarned you. I said this was going on. You said you would work with me in transitioning to more permanent housing, and you're not now doing that. Like, that's not happening, right? Fine, I'm out. And in doing that, what do they see? Well, they see another one that just hits the dust. They are so overwhelmed with everything they have to do. There are so many people who have needs that they just can't meet them all. And so they just have to come up with a system that says, you're deserving and you're not deserving. And he's just one that doesn't fit the criteria. And therefore, he might be manipulating the system, or he might be taking someone else's spot, or, they can't meet everybody's needs, and it just is. So he's just another number. There's that distance part, right? We've talked about creating that distance where we're not emotionally vulnerable, we're a little more distant. He's just another one of those. And in so doing, what happens there? Well, he feels like another number. He feels like just another person. And he feels like, yep, I just have to take it. I knew it, that they did not see me and my needs genuinely for who I was. There I am again. And it validates that. It feeds into that. And so he lets them just keep doing it. Instead of saying, wait, could you see here for a moment? Could you at least validate? So that's how the collusion will work there. I think we've talked about that. But where did they get to this? Well, human services, people who are trying to work in housing, they have to have income requirements. They have to have these criteria. Why? So that fraud and abuses of the system don't happen. They have to have them. Why? Because it has happened. So SD kind of got caught up in that. And there's a lack of availability of housing. So we have to triage who is the most important and who isn't. Is there not a lot of demand for housing in Utah? There totally is. There's a lot of homelessness here. So we can see that there has to also almost be like this step back in depersonalization, because there is so much overwhelm when you're a provider in the housing. So now that we understand SD and we understand people in housing, how would you bring that together in a way that says, I understand both, I can hold both, and for the benefit of SD, or for the benefit of myself, or for the benefit of housing, how would I hold that in a port of entry where I hold it all together? And this is where I want you guys to think. What would you say? You might say to SD, you were doing the best you could in your circumstance and no one showed up for you. And when someone finally did, and they asked the very thing you did have at the time, and that was you moving forward in your life with schooling, a part of you died. I get it. They were scared of offering a program for temporary housing and losing all their grants and losing all their funding if a student was discovered on their records, and they weren't careful enough to think about that before. They were scared that all these students could take advantage, and maybe a needed advantage, of such a limited resource that maybe had a, an earmark to a higher priority, like people who are chronically homeless on the streets, right? They were hurt. They were scared. You were hurt. I get that. That takes a lot of vulnerability, but it also shows what is alive in us, right? We're getting back to that piece of what is alive in us. So let's speak to that for a moment. Does anybody want to kind of answer those questions? Oh, I guess I had another one here.
I'm just thinking that, so I'm in Chandra's year-long training for CPT.
Are you? How
I am.
lucky.
Yeah. And so it's nice that some of this resonates with, what she's talking about in there. But with these ports of entry, one thing she keeps stressing is the idea of scooping, right? So scooping both people up to, to validate both their experiences and honor their experiences, while also, like you said, reflect on maybe the pain that's going on for each of them, or the frustration or the limitations. So I guess just to bring that in light, to remove ourselves as a shiny object, but more also try to help them see each other's point of view too.
Good. Yes. I love that you made that connection. So let's bring it back to Marshall Rosenberg here for a moment. I'm sorry, I'm just making sure I know where I'm going in this presentation. So let's say that what is alive in these systems? We could go in and say, hey, the stupid housing people had no idea what they were doing. They shouldn't have done that. They really messed it up. You should go and file a complaint and sue them or something. Which, maybe that's an okay thing to do, because those reiterative processes of checks and balances are important for learning. But there's also this feeling of like blame versus, okay, what might be going on here? What is alive in us? Well, what's alive in the housing system? What do you think that they're really worried about? What are they really wanting? Any thoughts?
Are you saying, what is the housing system wanting?
Yeah, what's that deep part of them that's like really motivating all their behaviors here that weren't helpful in the end, but what was really underneath it all?
So I have friends that work in that environment, and it has a lot to do with funding or being defunded, or not, complying, not being able to pass their next audit, all those kind of things. So they're like, their job and all their availability for several people, like to sacrifice for the one might compromise everybody maybe within that area that they govern.
Awesome. Yep. So we're looking logistically that we have to be able to keep our licensors and permits and funding, and there's strings attached. And so we want to keep that going because we desperately want to help those who we can. So there's that desire, that humanness of, I really want to be able to provide this. I really want to see people off the streets. I want people to know that they're valuable to me. And Candace brought up, like, there's this powerlessness of, we can't help everyone. There's this overwhelm. And so then when you're defeated and you're noticing that there's so much more need than resources, you sometimes do turn to, these mind games of saying, well, maybe you don't want it enough because you weren't willing to, do what was necessary to meet the criteria, or things like that. But yeah, that's just based on this, like, there's so much need and I'm overwhelmed with how to meet that need. And that could be burnout, right? So when we notice that, it would be a very much different delivery. Let's say if you took the person in housing and said, SD, I am letting you go because we made a mistake of not noticing and working with you on preparing you for a transition sooner because you were working so quickly on being a student. And maybe the honest fact is I doubted you. So many people say they're going to be a student and you blew us out of the water. Good for you. You got there way sooner than we're used to. And maybe that was part of it, and we're really sorry. But because we have to keep this funding, and it just is the situation as it is, I am going to do what I can for you. I am going to be on your side because you still deserve to be heard. So we are going to have to release you. Can we get you in with a friend? Can you continue to come back and visit us until we can still get you into that permanent housing? You know, that conversation sounds a lot different because you are so aware of what SD is going through. And you can say, I'm really, going on. Or if SD was able to say, like, I know that you have strings attached. I know that I have to comply with this because of that. And I still have a need here. I still have a need for you to see how I'm struggling and to know that you see that struggle. If you can at least see that struggle. And so many of my clients, that's what they want to know. They want to know, do you see it? Can you validate it? It's not always something that you can solve, but can you sit there with them in that discomfort? So yeah, but you have to come up with what's alive in each party. And often when you do that, you see the mutuality. SD really can see that, wow, they actually really do want to help, but there are some limitations and it's beyond their control. And the housing people can say, wow, SD really is somebody who would benefit. And he really is a person who's trying. And he really is moving forward. And now we have a new dynamic. But we had to get to what's alive in each of us rather than saying, oh, you're a threat, get out of here. Woo, student, woo. Can't have that. Okay. Let's think about parenting. Why did the parents of SD back away and say, oh, this is really scary. You've sexually abused someone. You've had to go through all this treatment. And now we don't know what to do with you other than just to say, you did it and we don't trust you again. Well, I can tell you something. This man's a grown man now. His parents grew up in the 50s. Has anybody ever heard of the child was seen but not heard? Where did that come from? Psychologists, they taught around the era of World War II, do not coddle your child. It will harm them. It is a bad idea. And so no doting, no interactions, let them learn the hard way. So here we have parents, when this comes up, they're like, I'm overwhelmed. I don't know how to respond to this. All I know is what I was taught, and that is, let him suffer. Let him suffer the consequences. This is emotionally overwhelming to me. That's what happened to me. If I have a big emotion, my parents just said, enough, go take care of it. And I don't know how to handle that. And so here he is in this similar situation. So when you think in that historical lens, what is your port of entry now? How would you come in? You needed someone to see how brave and courageous it was for you to own your mistake. And you felt they saw you as dirty and untrustworthy. Your providers and parents were scared because they didn't know how to reach out and actually connect with you and support you. So they just pushed you away and shut you down. Why is that an important thing? Because what it really means is, wow, they wanted connection, but they didn't know what to do. So instead of telling them, well, you weren't there for me, and what's wrong with you, you say, oh, now that I know what they weren't able to do was seek connection, I am now empowered to go grab that connection and say, wait, this is what you wanted all along. Well, guess what? That's what I wanted all along too. I wanted your support. Now we're back to Martin Luther King Jr., that network of mutuality. Really, when we drive down to it, our goals are incredibly mutual all the time. And why was he being tased? What's up with that? This is an interesting statement SD said. I feel no malice. They were trying to be helpful. They weren't trained, and they were trained, and they were taught to attack a problem. I just needed someone to listen to me and understand. He's already got this healing statement in his brain going on. He's figuring it out. So 5 minutes left. Okay. So think about what your consumers and your students and your clients bring. What are their past histories? What are historical forces driving those things? What do you bring into your work? Who do you work with? What are your narratives and stories that you create around the people you work with? But remember to focus on what is alive in us and what would make life more wonderful for us. And if I show up that way, could I maybe think of a different way of participating in this collusion of trauma that would actually be a collusion of healing? So here's Martin Luther King Jr. again, you know, tied together in an inescapable garment of destiny. Oh, sorry, in a single garment of destiny, caught in an inescapable network of mutuality. If we had hours and hours, I really believe we could break down every social system, every law, look at the historical forces behind it, look at the trauma that's informed it, like the war on drugs. There's a lot there, many, many others, and say, wait, this is participating in the same collusion. And actually, when we boil down to the needs of all the parties, we actually do see some solutions. But it takes a lot of vulnerability and openness to get there, and not protective stances. So I kind of want to send this home with Dr. Gregory Boyle. He is a man who's had really successful work in gang intervention programs in LA. This is what he said. And so you choose to go from here, and you dismantle the barriers that exclude, and you go out to the margins, because that's the only way they'll get erased. If you stand out at them, and you stand with the poor and the powerless and the voiceless, and you stand with those whose dignity has been denied, and you stand with those whose burdens are more than they can bear, and every one of you here has had an exquisite mutual experience of knowing what it's like to stand with the easily despised and the readily left out. Sorry, he's a little long-winded, so that's his quote. But anyways, you go from here to stand with the demonized, so that the demonizing will stop. You stand with the disposable, so that the day will come when we stop throwing people away. For no kinship, no peace. No kinship, no justice. No kinship, no equality. You go to the margins, not to make a difference, because then that's about you. You go to the margins, so that the folks at the margins make you different. That mutuality, that our healing is tied up together. When we show up vulnerably and show what's alive inside of us and are able to see what's alive inside of others, that's that margin. That's standing with people enough that we even become different. We actually heal, in a sense. And that progress together for them, and they're also healing as well. For no kinship, that togetherness, no justice, no equality, no peace. So that's the main thrust of it. And thanks for listening. If we have a few minutes, I'm happy to take questions. Oh, and these are a lot of the books I used. Not all of them, but big ones.
Thank you so much, Alexander, for your time, for your expertise. This has been a really great session. Really appreciate it.
I see a hand from Teresa floating up. I thought. Did you have a question?
Using reactions to do applause.
Oh, okay. Sorry, I misread it. Forgive me.
I did just put a link in the chat to that feedback survey. Again, I'll also send it out this afternoon via email as well. But thank you so much again. This has been a really great session. I think it's given us a whole lot to reflect on and to think about. So thank you so much.
You're welcome. It's good to be with you guys. Love to be in contact if anybody wants to be in contact. I actually love talking to people. I'll just give you quickly my email in the chat box. Yep, if you ever want to strike up a conversation.
Aaron, I'm having trouble with the link. I click on it and it keeps going away. So,
oh no, let me try again. Let me paste it again and then also make sure that it is the correct link. Not be the first time I've sent the wrong one. Okay, is it working for you now?
I think so. Wanted to just copy and paste it real quick before it was gone. I'm like, find it quick.
Also, again, I'll send it through email. So if for some reason it's not working for you, you should have that later this afternoon.
All right. Thank you.
Okay. Thanks so much, everyone. Hope everyone has a nice Friday and a nice weekend.
You too. Thank
Bye,
you.
everyone. Thank you.
Bye.
Bye.